This is the VOA Special English Health Report. New research could raise hope for women who are having trouble getting pregnant. For years, the thinking has been that women are born with all the eggs their bodies will ever produce. In fact, this has been the thinking not just about humans, but all mammals. Then, in 2004, a researcher at Massachusetts General Hospital reported that adult female mice could produce new eggs. Now, Jonathan Tilley has extended his work and reported another discovery, this time about human females. We've isolated essentially the female equivalent of the stem cells that we know exist in men that actively make new sperm. He says having these cells now isolated opens up a lot of opportunities to consider. Stem cells are special kinds of cells. Starting in embryos just a few days old, they produce the many different cell types and tissues that form the body. In some adult tissues, stem cells produce replacements for damaged or worn-out cells. In his new study, Jonathan Tilley and other researchers removed cells from ovaries. Ovaries are the female reproductive organs that produce eggs. The scientists did laboratory tests to make sure they had the right cells that they were looking for. Then they used what are known as culturing methods to grow the cells so they would divide and produce more cells. And we could start with perhaps 100 cells, and over several months' time, take those 100 cells and make hundreds of thousands of cells. And, interestingly, we noticed that these cells would spontaneously generate immature eggs, all on their own in these cultures. The researchers then placed some of the cells into human ovary tissue and implanted the tissue under the skin of mice. The studies found that these human cells were, in Jonathan Tilley's words, more than happy to create brand new human egg cells. He says growing eggs in the lab could improve the chances for women who are having the process known as in vitro fertilization. With IVF, an egg is fertilized with sperm in a laboratory, then placed in the woman's uterus to develop. Jonathan Tilley says his work could also lead to fertility treatments that might improve the chances for more traditional fertilization methods. The journal Nature Medicine published the findings. Some experts raised questions about his earlier work with mice. Some are not so sure about his study either, until other researchers can reproduce the findings. For VOA Special English, I'm Mario Ritter.
This is the VOA Special English Health Report. The journal Science chose an AIDS study as the 2011 breakthrough of the year. The study found that antiretroviral drugs can greatly lower the risk of spreading HIV, the virus that causes AIDS. It showed that infected people with early treatment were 96% less likely to infect their partners. The study was a clinical trial known as HPTN-052. Myron Cohen led an international team that began the study in 2007. But Dr. Cohen says the work really began 20 years ago. We had a strong suspicion, based on all the biological studies we had done, that when we treat people, and lower the concentration of HIV in the blood and secretions, we were rendering them less contagious. But we didn't understand the magnitude of the benefit. Dr. Cohen heads the Institute for Global Health and Infectious Diseases at the University of North Carolina at Chapel Hill. The National Institute of Allergy and Infectious Diseases paid for the study. It involved heterosexual couples in 9 countries in Africa, Asia, and the Americas. The results have already had an effect on government policies. Those changes include treating HIV-infected people when their immune systems are still relatively healthy. Dr. Cohen says the study has generated policy changes at the level of the United States and the World Health Organization and UNAIDS. And it's inspired new community-based clinical trials that are just about to be launched that apply the scientific discovery. He says the results will be wasted unless they are linked to other areas of HIV testing, treatment, and prevention. If we don't know who's positive and negative, there's no benefit. If people aren't linked to care, there's no benefit. If they aren't provided drugs, there's no benefit. If they receive the drugs but don't take the pills, there's no benefit. So this cascade is now the focus of our attention. AIDS activist Mitchell Warren says, "For many years, debates have waged whether we should do treatment or prevention. The results of the HPTN 052 study actually affirm once and for all that treatment is prevention." The journal Science also recognized 9 other achievements. These include progress on a malaria vaccine and research on the DNA of our ancient ancestors. Another study looked at cells that have stopped dividing. It found that clearing them from the bodies of mice can delay some of the effects of aging. A link to the full list is at voaspecialenglish.com. For VOA Special English, I'm Alex Villarreal. From VOA Learning English, this is the Health Report in Special English. An advisory group has suggested that everyone in the United States between the ages of 15 and 65 should get tested for HIV, the virus that causes AIDS. The U.S. Preventive Services Task Force says wider public acceptance of HIV testing could lead to earlier treatment for those infected, and it would further slow the spread of AIDS. The 16 medical experts on the task force are appointed by the government. They examine scientific evidence for and against healthcare services designed to prevent disease. HIV is spread through unprotected sex or contact with an infected person's blood. In 2005, the task force recommended testing for all pregnant women and anyone at increased risk of HIV. Now, HIV tests could be offered as an early screening tool. He says that makes more sense than offering it later when people go to the doctor for tests to find out why they are sick. An estimated 1.2 million Americans have HIV. Each year, about 50,000 more get infected. Up to 25% of all infected people do not know they have the virus. But among young people, the Centers for Disease Control and Prevention says about 60% do not know it. The CDC says 1/4 of new infections in the United States are in young people aged 13 to 24. December 1st was World AIDS Day. The latest United Nations AIDS report says 25 low to middle income countries have cut their rate of new infections in half since 2001. Most of those countries are in sub-Saharan Africa. But UNAIDS researchers say the number of new cases has risen more than 35% in the Middle East and North Africa in the last 10 years. For VOA Learning English, I'm Alex Villarreal.